Illinois seeks to expand gender-affirming care that a national group says is harmful to kids. Biden's new staffing requirements puts Illinois nursing homes in peril. New documents reveal Gotion has ties to slave labor practices and genocide. Survey shows increase in Illinois small businesses facing rent difficulties. These are just some of the headlines you'll find at thecentersquare.com/Illinois. I'm Greg Bishop, the Center Square Associate Editor for Illinois, and that's what I do in my full time. Part-time here, I just hang out with you from my home studio, but I want to, of course, point you to go check out thecentersquare.com/Illinois, where you can see these headlines and more, and we'll touch on some of these, including Illinois seeking to expand gender-affirming care that a national group says is harmful to kids. But some of the other headlines for today, former Illinois House Speaker Michael Madigan's chief of staff and House Clerk Tim Mapes reports to prison today for a 2.5-year prison sentence. Back in August of 2003, the federal grand jury found Mapes guilty of perjury and obstruction of justice for lying to a grand jury investigating Madigan and others. He's to report to the Federal Bureau of Prisons before noon today. Madigan faces trial on 23 counts of racketeering, bribery, and official misconduct in a separate case. That goes in October. And if you've been interested in that case, you can follow the latest. Go to thecentersquare.com and search Madigan or Mapes, and you'll be able to find some of the latest reporting there. Again, thecentersquare.com/Illinois. Some of the other things to keep in mind for today, Governor J.B. Pritzker, he's out of the country, leading a delegation in Canada that his office says is meant to discuss further opportunities for collaboration. Now, Canada is Illinois' largest trading partner. The Illinois Department of Commerce and Economic Opportunity reports from 2009 to 2022, exports to Canada increased by $37 billion, supporting 800,000 jobs. Top exports for transportation equipment, petroleum and coal products. Top imports are oil and gas and food. So again, just some of the other headlines you'll be hearing about throughout the week. But let's go to this story here from thecentersquare.com. Illinois seeks to expand gender-affirming care that a national group says is harmful to children. So yesterday, an announcement came out from the Illinois Department of Human Services. It said a recent survey from the Center for American Progress found that 1 in 5 LGBTQ plus adults say they avoided care due to disrespect and discrimination, growing to 1 in 3 in transgender and non-binary respondents. Now, Monday, the agency announced the Transgender and Gender Diverse Wellness and Equity Program that they said will train organizations across the state to expand gender-affirming care. I'm just going to pull up this news announcement. No, I don't want cookies. So it's, a press release, reviews all the particulars, provides some quotes. Talks about the organizations that are going to be taking part in this, with the Public Health Institute of Metropolitan Chicago being the lead. Some of the organizations that are part of this: Southern Illinois University. You've got the Douglas County Health Department, the Champaign-Urbana Public Health Department, but also organizations like Youth Outlook or Rainbow Cafe LGBT Plus Center in Carbondale. And if you go and check out some of their websites, you've got the organizations, talking about how they provide, nonprofit services, prioritizing a holistic model of community care to support LGBTQIA plus people of all ages. You've got a Naperville organization, Youth Outlook, saying they have drop-in centers that are safe, appropriate, and affirming spaces for LGBTQ plus youth. They say that their health and wellness services assist youth and families to find affirming providers. So again, these are just some of the statements from the organizations that are going to be part of this. Now, the agency didn't immediately respond to my questions about the taxpayer cost of this program or whether it would be geared toward people under the age of 18. But some of the comments from the news release, for instance, Dulce Quintero said in a statement, IDHS is committed to meeting the people of Illinois where they most need empowerment. We're so proud to play a role in this programming for our gender diverse community. So that's the general statement that was sent out. But this was Monday, right, when this goes out. So yesterday. However, on Friday, over in Washington, D.C., there was the American College of Pediatricians holding a news conference pushing back against the idea of gender-affirming procedures. Dr. Andre Van Mol of the American College of Pediatrics announcing a declaration, doctorsprotectingchildren.org. Here's what he had to say on Friday about transgender ideology, he said.
Gender dysphoria is a diagnosis, whereas transgenderism is an ideology. The natural course of gender dysphoria is desistance by adulthood, conservatively in 85% of the cases, unless it is affirmed. Gender dysphoria carries with it the overwhelming probability of underlying mental health issues, adverse family dynamics, adverse childhood experiences, and autism spectrum disorder that usually predate the gender dysphoria itself. The probability of both desistance and underlying mental health and other issues is why watchful waiting, coupled with mental health evaluation and counseling for both patient and family, was once and is increasingly again recognized as the standard of care for minors with gender dysphoria. Systematic literature reviews done in the United Kingdom, Sweden, Finland, and Germany show that so-called gender-affirming healthcare is out of step with the evidence base for gender dysphoric youth. Transition affirmation is not proven to be safe or effective long-term. It does not reduce suicides. It does not repair mental health issues or trauma. Minors cannot give truly informed consent. Children have developing and immature brains. Their minds change often. They are prone to risk-taking. They are vulnerable to peer pressure, and they don't grasp long-term consequences. Refusing to provide gender transition procedures, or so-called gender-affirming healthcare, is non-discriminatory and is appropriate both professionally and scientifically. Withholding unproven interventions is non-discriminatory, and gender-affirming healthcare has neither been shown to be safe nor effective nor of more help than harm. Physicians take an oath to do no harm, and gender-affirming healthcare is documented to lead to harm. There are good mental health alternatives to gender-affirming healthcare, which address underlying issues rather than dodging them. Finally, there is always a more honest way to deal with gender confusion than the chemical sterilization and surgical mutilation of healthy young bodies.
So again, just one of the statements from the American College of Pediatricians pushing back on this. Others pointed out that England, Finland, Denmark, Sweden are reversing their gender-affirming treatment positions and advocating for more successful standard of care, psychiatric evaluation, and treatment. Here's another individual, Lewis Brown of the Catholic Healthcare Group, and he says that the declaration they're signing, people need to jump on with because children's lives are at stake.
The Catholic Healthcare Leadership Alliance is pleased to support the Doctors Protecting Children Declaration because every child deserves ethical medical care that protects each child's life, health, and human dignity. Medical and scientific research clearly demonstrate that so-called gender-affirming procedures are seriously harmful to a child's physical, mental, and emotional health and well-being. Children dealing with gender confusion or gender dysphoria are owed love, compassion, and medical care based on the truth and goodness of their humanity and body, mind, and soul. To protect the health and dignity of millions of children, medical associations, healthcare professionals, healthcare entities, and government healthcare programs at the state and federal level must stop promoting and providing unethical and harmful so-called gender-affirming procedures. To advance a civilization of love and justice, our American healthcare system is ethically obligated to provide children with medical care that is healing, medically and scientifically credible, and that leads to true human flourishing. Justice demands that our nation's healthcare system provide care that upholds the beauty and truth of every child's dignity and true identity.
So you can go and see even more comments that the American College of Pediatricians had. And it was interesting that came out Friday, and then yesterday you have the Illinois Department of Human Services release the announcements that they are launching a new program to expand gender-affirming care. But again, I did not get a response as to if this program is going to be catered at all towards individuals 18 and younger. And what's the taxpayer cost of this program? So interesting to see that. All right, some of the other headlines, again, you can find at thecentersquare.com. Definitely encourage you to go read. Interesting story about Biden's new staffing policies that a nursing group says is going to put some nursing homes in peril, especially because the requirement is to have a certain number of nurses hours per patient, but also to have 24-hour overview by a certified nurse, and there's a nursing shortage, so that could be problematic. But you've also got the story, Congressman Darren LaHood put out a note that he sent to the various federal actors responsible for regulating businesses, and says that Gotion has some questionable ties. So I'll just read a little bit of this story for you. Again, find it at thecentersquare.com. Illinois U.S. Representative Darren LaHood says in a letter to the U.S. Department of Homeland Security that the Chinese battery manufacturer Gotion has ties with companies directly linked to slave labor, genocide of the Uyghur Muslim population. And you can actually go and read that letter. And some of the reaction from a group that's suing Gotion. You've got a group in Kankakee County pushing back on Gotion, trying to levy a lawsuit, and individuals there saying that LaHood's letter could very well lead to some positive developments in their lawsuit. So fascinating to see that headline as well. So those are just some of the things to keep you informed this morning of what's going on at the Illinois Statehouse. So be sure to go and subscribe to the newsletter for thecentersquare.com, where you can even just, if you want national news, you can get national news. If you want just Illinois news, you can get just Illinois news. But subscribe and check that out at thecentersquare.com. All right. Like, subscribe, hit that notification bell. It's Bishop on Air.